Hi, I'm Pamela Madsen, and welcome to another segment of Journey to the Crib. And I'm here with Dr. Dave Kreiner, who is the founder of East Coast Fertility. Thanks for joining us. I went to the doctor because I was bleeding heavily, and the doctor said, "Oh, you have polyps." And they took the polyps out, and then I stopped bleeding heavily. So what are polyps? What did I have? And I wasn't trying to get pregnant at the time. But would they have affected my conception rate?
A polyp is an extra piece of tissue from the lining of the uterus that protrudes into the uterine cavity. So yes, that polyp can be related to abnormal bleeding, and the way it could be related to the abnormal bleeding is perhaps you didn't ovulate for a month or two and maybe had extra buildup of the lining. And when the lining builds up abnormally, sometimes there's an outpocketing of the tissue in the form of a polyp. That polyp can be related to bleeding and would require polypectomy and dilatation and curettage, so-called DNC.
Oh yeah, I had that too.
and that would take care of the bleeding.
Got it.
And likewise, before we try to get a woman pregnant, and before we do an IVF procedure, we're always looking in the uterine cavity to make sure that there are no polyps. So we'll do what we call a water sonogram, hydrosonogram, and look to see if that uterine cavity is nice and smooth or if it has any extra tissue or polyp in the cavity. And if there is, then we'll do a hysteroscopy and DNC in the office and remove it.
Could that be reason enough that I can't get pregnant?
Yes, and when that's the case, it's a wonderful thing because it's perhaps the easiest thing for us to treat.
Wow. So you mean a woman may not know she has a polyp, may not be getting pregnant, and during her initial infertility workup, it would be one of those things that would be discovered during the initial workup through the histosalpingogram or sonogram?
Certainly before doing an in vitro fertilization procedure, we would work a patient up for that.
Okay, so now I learned about polyps. Thank you. That's great.